guys, I'm gonna make a video of 5 career field that if you are trying to be a doctor, an MD or DO, for some reason you can't get in, or for some reason you do not want to do that avenue, but you still want to be a doctor and you want to see if there's other alternative to becoming a doctor and get that doctorate level degree so that you can work in the medical field, then here are 5 different career fields. Now there are plenty more than 5. There's a crap ton, and we can talk all day about them. But we're gonna limit it to 5, that I have chose for myself. Now, if the what I have mentioned is not, or what you have in mind is not in the video, please leave a comment, say that, oh, you didn't mention this or this, but this is only 5, so I'm only going to talk about 5. Okay, the first one, the alternative to becoming an MD or a DO, is to be a PharmD, right? Pharm stand for pharmacy, and D is doctor, so doctorate of pharmacy. Now, doctorate of pharmacy is a lot more than a lot of people would think. Being a pharmacist, a lot of people would assume you're working on CVS or Walgreens in front of a counter counting pills all the time, and that's not really what a pharmacist does entirely. Usually you have tech helping with that, but usually what a pharmacist does in these kind of scenario is do consultation with patient, and they're free. These consultations are free. They can talk about, oh, it's this medication or that medication. They can kind of look at your medication and see, oh, this medication and that medication is fighting each other. They're a pharmaceutic expert, and they are probably more knowledgeable than what an MD or DO would know when it comes to pharmaceutic, because they have to go through these doctorate program to learn about, like pharmaceutic, than just like broad medical knowledge all over the board, right? Now, of course, you still need to know about human body and stuff, and you still learn about medicine, like what an MD and DO needs to know as well. But we'll get into that. So I'm gonna make pharmacy the longest because I know a lot more about pharmacy than other fields, because that's the field that my wife is going through right now, and I got her in, so I put myself credit for that. So now, a lot of people think of like pharmacy being counting pills on CVS. Now that being a pharmacist in that kind of setting does not require a doctorate, right? You can do a B Pharm or an M Pharm, but things are getting a little more competitive in that field, so they might not hire you with a B Pharm. But I know a lot of people that finish with a B Pharm, a Bachelor of Pharmacy, and they still be able to become a pharmacist in these kind of settings. Now, the other avenue you could pursue with a PharmD, and usually what a PharmD would pursue, is going through a PGY1 or PGY2 residency, and that would entitle them to do specialty care pharmacy. Now, these specialty care pharmacy breaks down quite a bit. So you have your ambulatory care pharmacy, which is like an internist setting where you have an office, you are in your lab code, and you're seeing patients every single day, and these pharmacists and doctor of pharmacists would sit with a patient, and they're pretty much like an internist or a family medicine doctor, where they would just kind of look at the patient, blood pressure. They would look at their heart, and they would do a physical. Then they would go and they would look at their drug lists and medication, and see, oh, well, this medication and that medication is fighting each other. Well, the doctor or the MD or DO didn't catch that because they're not as skilled in the pharmaceutics as pharmacists would be. So they would look over a patient's records, and then they would go through this for like even 45 minutes versus like a regular doctor that can only see a patient for 10 minutes, and they have to have nurses and stuff like that because they're just so busy with insurance and other things. So this is the one benefit of being in the pharmacy field and doing ambulatory care, is that you have more patient interaction. And there are quite a bit of pharmacy field, so we're not going to go through all of them. I might just gloss. There's psychology, where you do psychological medication. You can do clinical care pharmacy. You could do emergency care, where you're in the ER and you're working with doctors, MD and DO, and nurses to look at the patients that's going on, OD, or they are an older patient with a lot of medication, so to give them a certain medication right then and there to help with certain thing might actually cause more negative consequences than it is actually worth. So, like I said, this video, pharmacy, is probably going to be the longest because that's the field that I know the most. All right, so that's pharmacy, right? And pharmacy is a very wide range of what you could do in pharmacy. Now, the other things that if you do not get into MD or DO, or you don't want to go to do an MD or DO, is very obvious. Be a veterinarian. Now, you're not going to be working with humans, but you need to know everything that a doctor would have to know, but in the animal setting, right? And you can go residency, but you don't have to, right? You don't need to deal with the matching process, and to get into the veterinarian program, it's not as competitive, right? Now, you can get into specialty and what do you do for the animals or whatnot. Okay, not for everyone, but that's a good alternative, right? If you want to practice medicine, this is probably the second best alternative. Third is, being a doctor of public health. Now, you don't need a doctorate to practice public health, right? You're probably not going to see patients a lot, probably not at all. You're probably going to be working with hospital or whatever firm to see the contagions, how it would spread, or like see if the hospital are doing things to prevent mass infection or stuff like that. That's more of like a backseat type of degree, but it does pay very well, and you're still in medical setting, and it's still very in high demand, especially in the federal government, for sure. So now we're going to number 4. We're going a little quick. Is AUD, Doctor of Audiology, right? And a lot of people don't realize that that's a whole specialty by itself, AUD. Now, I know a lot about AUDs because when I was looking for an alternative field for my wife, AUD popped up, and was one of the field that we were really looking into. But then we're just like, okay, we found pharmacy, let's go to pharmacy. Pharmacy is probably the easiest to get in right now because there's a lot of school and not a lot of people applying because not a lot of people know about it. So if you go to pharmacy, you usually need to take PCATs, the kind of the MCATs equivalent for the pharmacy section. Now a lot of school doesn't even, or they'll waive it, they don't even care, they just want to get you in. So that's something good about pharmacy. Now, I know we're jumping back and forth. Let's go to AUD, which is Doctorate of Audiology. I know there is James Madison University, which has a good AMU program, AUD program. They go through a program that is 3 years, and then the 4th year is rotation, where you would learn everything you need to know about how to be an audiologist. You can do specialty with that too, but like, I'm not going to speak like I'm the expert on it. And the last one I want to talk about is the DPM field, which is the Doctorate of Podiatrist Medicine, which is foot doctor, right? They're foot doctor and ankle doctor. Now, you do need to have, a lot of them, they require you to take the MCAT. So if you don't want to take the MCATs and you don't want to be an MD or DO because you just really don't want to take the MCATs, DPM might not be for you. A lot of school will substitute the MCATs with the GRE. So that's another test you have to take, right? So of course, there's plenty of other doctorate field. Like you could go into let's say things like physical therapy or occupational therapy, which is a whole nother doctorate program. Now, I don't think that a lot of people can be called doctor after those type of doctorate program. It's maybe kind of like JD program, like Juris Doctor, where you can get that law degree, but you still can't be called a doctor. So I don't know. I mean, you might be able to try, especially if you're in this setting. But yeah, those are the 5. Plus the 6th one, which is the occupational and physical therapy, field. So if you have any other questions or concern, or I might do a part 2 to this on what other field you could go into that is not, MD or DO. Of course. All right. please leave a comment, and if you agree or disagree, or if I get something wrong, or if you want to know more about pharmacy, like what is the process and how long it takes, and what's the difference between an MD and DO, like break down by like an MD versus a PharmD. What do you go through the school? What's the difference? Then I'm willing to make those videos. Make a comment, and if I get something wrong, that's right. Just make a comment, right? Just make a comment.